Hello, I'm Matthew Weinstock with Hospitals and Health Networks, reporting to you live from Phoenix, Arizona, and the 27th Annual Health Forum American Hospital Association Rural Healthcare Leadership Conference. Nearly 600 hospital leaders and board members have fled the brutal winter that's gripping most of the nation to come here to Phoenix to talk about the biggest trends and share best practices impacting rural hospitals. I'm joined right now by the AHA's John Supplett, who works very closely with rural hospital executives. John, thanks for being with me.
Oh, Matt, it's my pleasure, and I can tell you I am among those who are glad to have a respite from the brutal cold winter, the ice and snow that has plagued the Midwest and upper Midwest and most of the Northeast as well. So it's glad to be here, even for a few days.
Yeah, I think we all are. So, John, we've got, as I said, about 600 executives here, board members. What do you think are going to be the key 2 or 3 themes that are going to emerge this week?
You know, I think the themes that we're going to see are themes that have been building momentum for some time now. You can trace it back to the Accountable Care Act, but even prior to that, when you're looking at integration and delivery system reform. And as we see the market mature and as we see the sector get more engaged in transformation, I think you're going to see these themes surface during the course of this conference as well.
And you work closely with the rural constituency on advocacy and policy issues. What are the top priorities for those hospitals in this legislative session?
You know, it's interesting. You know, when we look at the themes of the conference, I think we're really looking more at strategy. And when we look at advocacy action, we're looking at tactics. It's the difference between what's here and now, which is the advocacy agenda. And I would really frame that as being many of the things that were left over from the past, let's say fall, October 1st. And that would be the Medicare extenders, low volume adjustment in Medicare dependent hospitals, ambulance adjustment, looking at some of the things that have come through regulatory channels such as direct supervision of outpatient therapeutic services, and most recently certification, physician certification of a 96-hour stay at critical access hospitals. Those are among the major priorities of our advocacy agenda for rural hospitals right now.
And do you expect here this week that there'll be a lot of conversations about how those rules are potentially impacting hospitals?
I think we will. I think we're going to hear that all the time. We'll hear it here at this conference. We'll hear it on the phone when we talk to our members. We'll hear it in the field when we're going out to visit them. We'll hear it at the state associations. I mean, those are the issues that are on the minds of the CEOs who are running the hospitals in the here and now. And you certainly can't blame them for looking beyond the tactics and the advocacy agenda because it's so important to them.
And so let's pull back a little bit and we'll go back to some of those broader themes that we think are going to be talked about here, particularly in the ACO or the move to value-based environment. Are rural hospitals getting left behind in that transition? I
don't think they're being left behind, and I think it's the challenge of having your one foot in the present and dealing with the immediacy of running the hospital, and then in the other foot looking at the future when you're looking at a transformation and the way incentives are being laid out to reimburse hospitals. You know, you've got the volume-based phenomenon, the volume-based payment issues that exist right now, and we're transforming to the value-based purchasing. And your question is, do I think rural hospitals are being left behind? I don't think they're being left behind. I think what they have to do is continue to look very strategically at what's happening in integration and transformation, and to work very closely with their boards, because these are community decisions now. It has a lot to do more with the population of the community's health than it does the number of services you provide and how you're paid for them. And that's a conversation that has to take place among leaders across the community and not simply within the leadership of the hospital.
And so as you look to that transition to value-based, what kind of things is the AHA doing to help rural members move towards that model?
Well, and I think the AHA's done a few things, and I brought a couple of them with me that I'll share, and that is first and foremost, the hospital's path to the second curve, integration and transformation. It's a document that just came out this January. It's the second major report coming out of the Committee on Research, and it speaks very well, I think, to the transformation that's taking place. And in some respects, when you read some of these reports, they're a little more general in their nature, and rural hospitals may not see themselves on the pages written in the report. But I think in this case, it is very much there. I really encourage my hospital peers to spend some time with this document. look at it very carefully and share it with your boards, because there's a lot of information here that needs to be discussed, and I think a lot of strategy that needs to be discussed as the hospitals move more towards the value-based purchasing environment.
This meeting's one of those ones where they can do that peer-to-peer sharing or sit and talk about it. When they get back to their institutions, though, do you get the sense that they have the time to think about those bigger picture issues when they're dealing with day-to-day environment that challenges rural communities?
I think that's the challenge, Matt, is that you've got to make the time for strategic planning and strategic discussions. And, you know, I certainly am sympathetic to the pressures that are placed on the CEO and the CNO and the CMO and those that are trying to make the trains run and provide the care on a day-to-day basis. But you have to carve out the time, because this change is so significant, and it has such large implications that if you don't carve out the time and do it on a regular and deliberate fashion, you're going to find yourself behind the curve.
Right. Well, great, John. Thanks for your time being with us today. Sure. And have a good meeting.
My pleasure. It's great to be here and away from the cold.
And so we'll have continuing coverage of the meeting all week in HNHN Daily, so be sure to check out our coverage when it comes out every day. I'm Matthew Weinstock. Thanks for tuning in.